We're going to just give our audience a few more minutes to get settled and get their Zoom all hooked up. Perhaps get a glass of water before we get started. I trust you are all indoors where our air conditioning in Tucson, unfortunately, still has to be on. At least the mornings are getting better, everybody. Mm-hmm. Okay, let's get started if we could. I'd like to welcome you to our first Diamond Children's Medical Center at Home Together webinar entitled Savannah and the Glass Half Full, which features a groundbreaking clinical trial within our Pediatric Hematology and Oncology program. My name is Nancy Davis. I'm a member of the Banner Health Foundation board, and I'm pleased to serve as your moderator for today's discussion. Thank you all for joining us and for being an important part of the Banner Health and Diamond Children's community of patients, families, and supporters. I'd like to remind you all that today's session is being recorded, so the audience is muted during the presentation. There will be time at the end of the program for questions, so please feel free to submit them anytime using your chat function at the bottom of your screen. I will moderate the Q&A portion of our program, and if we don't get to any questions, we will make sure that they are part of our resource website following the program. Every year, 10,000 children under the age of 15 learn that they have cancer. Right here in Southern Arizona, about 60 children, or 2 classrooms full of children, begin their cancer journey. Leukemia, lymphoma, and brain tumors are among the most common cancers affecting children. A hematological disease, leukemias are cancers of the bone marrow and blood and occur at the highest rate, accounting for nearly 1 out of 3 cancers in children. Today, you are going to hear from Savannah Perez, who at the young age of 12 has battled cancer 3 times, and now 1 with the help of her mother, Vanessa, who served as her half-match bone marrow transplant donor. You will also have the privilege of hearing from the man who saved her life, Dr. Emmanuel Katsanis, whose first in the nation clinical trial provided the answer when Savannah's cancer came back a 3rd time. With that, I'd like to introduce you to our first speaker, the Louise Thomas Chair in Pediatric Cancer Research and the Chief of the Division of Pediatric Hematology and Oncology, Dr. Emmanuel Katsanis. Dr. Katsanis, welcome.
Well, thank you, Nancy, and thank you everybody for participating today. I'd like to start by giving you a little bit of an overview on the number of bone marrow transplants that we have performed in the last 10 years at Diamond Children's. This includes not only bone marrow transplants, but what we call cell therapies. Many of you have heard about CAR T cells. We have treated 7 patients with CAR T cells. 26 patients have undergone what we call autologous transplant, and this is mainly for solid tumors, not leukemia. And these solid tumors can include brain tumors and neuroblastoma, a common tumor that we see in infants. 121 transplants have been allogeneic transplants, so that has required a donor other than the patient. In many cases, that has been a matched sibling or an unrelated donor. Some of them have been cord blood transplants, and more recently, haploidentical transplants. That's the focus of our discussion today. Not all transplants are done for leukemias. Many have been used for non-malignant disorders, and I'll go over a few of those. And the majority have been for hematologic malignancies. Most of them have been leukemias. So when you look at the breakdown of all the transplants, about 30% have been for acute lymphoblastic leukemia, which is the type of leukemia that Savannah has. 19% have been for the second most common leukemia that we see in kids, acute myelogenous leukemia. A variety of other conditions, including non-Hodgkin's lymphoma or Hodgkin's disease, severe aplastic anemia, 15% of transplants. And this is when your bone marrow fails and it doesn't produce any normal cells, but this is not a cancer. And then a variety of other disorders, including kids, babies that are born with no immune system, even some metabolic disorders, and patients with sickle cell disease that some of you may have encountered a patient with sickle cell disease. Now, how does bone marrow transplant work? It works in two ways. One, it allows us to give more intensive chemotherapy with radiation in some cases to try to kill any remaining leukemia after chemotherapy. But it also works because you give an individual a new immune system, and that new immune system can fight any leukemia that may be left behind. However, we have a problem in Arizona, or not only in Arizona, in many places, that the majority of the donors that exist in the National Marrow Registry are white of Northern European background. So if you're a minority, for example, African American, you only have an 18% chance of finding an unrelated donor. If you're Hispanic from Mexican background, that's only 37%. If you're Native American, that's only 50%, compared to whites of 75%. So over the years, we've had problems in finding a match for someone who doesn't have a matched sibling, especially in minorities. What haploidentical transplant allows us to do is use a family member that's only half match. And as you can see here, for every child, their father or their mother are always a half match. Their biological father and mother are always a half match. Siblings are 25% full match, but also 50% half match. So you can use either a half match sibling or a parent for haploidentical transplant. So what are other advantages? So we said it increases the immediate availability of highly motivated donors, as your parents would be. It's much cheaper because you don't have to, getting an unrelated donor or an unrelated cord blood would cost $50,000 or $70,000, even though the donor volunteers. By the time it comes to us, that's how much we would have to pay for that donor. There's immediate availability, not only for the initial transplant, but even if you need a second transplant. For unrelated donors, they have to agree, they have to go through a doctor exam, have blood tests, which often takes 2 to 3 months, and many patients with acute leukemia can't wait 2 to 3 months. And then they may have improved graft versus leukemia effect, as I mentioned, the new immune system fighting the cancer. Because they're only half match, you may have more of that effect. The protocol that has been used most widely across the country is a protocol that was developed by Johns Hopkins, which is a reduced intensity regimen. It means that it doesn't give a lot of chemotherapy up front. Patients on this regimen that do not get graft versus leukemia effect relapse. So they have only had about 39% of patients cured when they didn't have graft versus host disease and therefore graft versus leukemia. We modified this regimen to be more intensive up front. And the patients that we have treated since 2015 have done very well. We've published our results in 2 recent papers. And if you can see here, compared to about 40% with the Johns Hopkins regimen, we have 90% overall survival. And when you compare that with matched sibling transplants or unrelated transplants, it's actually better, not significantly better, but our patients have done really, really well. So from 2015, when we started doing haploidentical transplants, since we don't often find unrelated donors, that has replaced the types of transplants that we use for all patients, not just minorities. But we haven't stopped there. My laboratory does research, preclinical research, as well as clinical research. So we do work at bone marrow transplants in mice. And to show you how our clinical trial started, we saw that when you don't give T cells with transplant that are very important to cause this graft versus leukemia, all the mice develop leukemia and die by day 29. When you give T cells, but you don't give any therapy post-transplant, the mice die of graft versus host disease, but do not develop leukemia. If you use what Johns Hopkins developed, you save the mice from graft versus host disease, but they develop leukemia a little bit later, and most of them die instead of day 29, they die on day 46. And if you use our regimen that we developed, first in the mice, you see that the mice do not die of graft versus host disease, but do not die of leukemia either. So given these encouraging results that we published in the British Journal of Hematology, we moved on to start this clinical trial, which Savannah was part of. And we can't go into humans from mice and say, okay, we're going to change one drug from the other. We have to do that gradually. So we did it by different phases. 3 patients received a little bit of the new drug, the bendamustine. The next 3 patients received a little bit more. The next 3 patients, Savannah was one of those, basically only got bendamustine, the new drug, on day 4. And now we're moving with the next 3 patients, and we've enrolled, 2 have gone through it, and the 3rd one was just enrolled, that we're starting to replace cyclophosphamide, not only on day 4, but also on day 3. So far, our results have been very encouraging. What we have seen is the patients engraft earlier, meaning that their white cells come in instead of day 16, day 13. Their platelets come in instead of day 28, day 20, and they require less red cells and platelet transfusions. These patients in blue have had no severe acute graft versus host disease or extensive chronic graft versus host disease, less than what's the standard of care. They've developed much less infections from a virus that we often see reactivated after transplant that's called CMV, 80% in the control patients compared to only about 20% in the patients that have been on our trial. And then when you look at the disease-free survival, the first 6 patients are about at 70%. However, the last 5 patients, including Savannah, are at 100%. So we're very encouraged by this trial, and our goal is to complete this trial, replace the cyclophosphamide with bendamustine, and then seek out other institutions so we can have a randomized controlled trial to show that this would be better therapy, across the country and hopefully across the world. And I'd like to thank, Savannah for, participating in this trial, because without patients willing, to do this, we can never advance, to be able to cure not 90%, but 100% of our patients. Thank you.
Thank you. The results of your clinical trial are just truly amazing. And I think we all, those of us who are participating today, need to be so grateful that with the University of Arizona and Banner Health, that we have the opportunity to participate in and to sponsor world-class health care of this sort, and the clinical trials that are going on just daily in our community. So I think that's just tremendous. Now, I have the honor of introducing you all to Savannah and Vanessa Perez. They, of course, took part in this clinical trial, which has turned Savannah back into a rosy-cheeked dancer. She dances, folks. But I heard their story for the first time about a week ago, and I was impressed with both. I was impressed with their courage, and I'm so glad that they can join us today. So Vanessa and Savannah, it's all yours.
Thank you. I just wanted to give a little background about Savannah and just kind of tell her story. And I hope that everyone is just as encouraged as she's been, and just, just brave as her. Savannah was only 3 years old when she was first diagnosed with leukemia, and that was in 2011. She had what I thought was just a cold. She had a high fever, a very deep cough. She had, just all the normal things that you would think of a cold is. And it was during that time of the season. So, took her to the doctor, gave her some antibiotics, only to find out that they weren't working. We had to do some further testing, and then she was diagnosed with ALL leukemia. I knew nothing about leukemia. I had no idea what it was. It was my first encounter with that type of cancer. So I did not know what to expect. Thankfully, we had the amazing team at Banner to help me through it, doctors, nurses. But going through this treatment, it was a grueling 3 years of treatment, lots of side effects, something that a 3-year-old should never have to go through. She, even though she was going through all of that, she still always had the best spirit. She was a kid, and she was just, spunky and, always fighting, but she did do great. After finding out that she was in remission and she was well enough to start school, she started kindergarten and started just living a normal life. And one day again, same type of thing, thought that she had come down with a cold. She was, coughing, all the same exact things. Deep down, I knew exactly what was going to happen, just because I had this mother instinct. So took her back to the doctor to find out, again, she had relapsed with ALL. Worst nightmare I could have ever encountered. So to be told again, we would have to do 3 long years of treatment again. This time, side effects were even more intense, and they were very hard to watch her go through. I remember just sitting there and just thinking, what could I do to help her? And, as a parent, you just want to do whatever you need to do to make your child feel better. And there was nothing I could do. And that was probably the hardest part about going through all these treatments. So again, she went into remission, and, this time she was a little older, so she started becoming more social, went back to school, made lots of friends. She started dancing folklorico. In case nobody knows what that is, that's a Mexican folktale dance, kind of like ballet style. And she just started thriving, and she was really good at dancing, and she had lots of friends, and it was such a great time to celebrate. And then again, she started feeling sick once again, but this time it was a little bit different. But I just knew something was wrong. Took her back into the doctor, and sure enough, she had once again been diagnosed with ALL leukemia. We were heartbroken and devastated. We just didn't know what was in store. This time it was a 3rd time around, and we were so nervous. I myself just could not think past side effects. Like, this time, what would it be? Since the other 2 times, each time I felt like got harder. This time I was so scared for her, and I just didn't know what to expect. And after talking to the doctors, they said we would be doing a bone marrow transplant this year. I've never, known anyone that has had one, so I didn't know what to expect either. Thankfully, again, with the amazing, doctors, Dr. Katsanis, all the nurses, they were my backbone. They explained everything to me. I just remember my first consultation with Dr. K, and I don't remember like a lot of the words that he used. I didn't know half of them. They were so big and scientific. I was like, I trust that you know what you're doing. And the only thing that I got out of that entire consultation, even like notes and booklets and everything that I had, was less side effects. And that's honestly was the most important thing to me. And of course, Savannah's well-being, but I just was worried about that. So after talking to him about this study, I was all in, and we were ready to do what we needed to do to save Savannah's life. There was also another thing in there, was I would be her donor for bone marrow. And that to me was the most amazing thing too, because not only did I get to, bring her into this world, but save her life again. So I felt like it was just my calling, my time to help her. And, like I said earlier, as a parent, you want to do whatever it takes to help your child, and you will do whatever it takes. So I signed up to, we all got tested. She doesn't have a full sibling, so it had to be her father or myself. So we decided it would be me. And we checked into the hospital, and we got ready for the journey. And, it's all history after that. It was just such an amazing experience. And I would do it again if I had to. So, I'm so thankful for that. One of my best memories of that, though, is the day of her bone marrow transplant. I made everybody promise that, including Dr. Katsanis, that they would wait for me. After I did my part of them taking the bone marrow from me, that they would wait to start the process until I got back up. I was like, I don't need a lot of recovery time. I just want to be in the room. And they did. So immediately after them taking the bone marrow from my hips, I was wheeled upstairs like so quickly. I don't even think I had time to take out the IVs that I had. I was just such in a hurry to get up there. So I could watch her first drop of bone marrow go into Savannah. And we got to sit there and experience it. And it was just such an amazing miracle. It's amazing. So, I'm just very, like I said, very thankful for her life and everything that we've been able to accomplish through this. It's been wonderful. We had our nurses that just supported us in every single way. And Savannah actually wants to just talk about two of her nurses that just mean the world to her. And she just could not think of doing her bone marrow transplant without them.
I want to talk about one of my favorite nurses. She has been there since the first time I've been diagnosed with leukemia. And she wasn't a nurse at the time. She was a child life specialist. And she was like a friend to me, not really like, I thought like they brought her there to play with me like every day. And we like always used to play. She used to bring stuff for me. And the second time, she was, what was she doing?
She was a nurse. Mm-hmm.
She was a nurse, and she was still practicing to be a nurse. And at clinic, she was like, I need someone to practice on to do a port. And I was like, oh, you could practice on me. Mm-hmm. And then she was like so nervous. She was like sweating. She was like really like, she was like excited but nervous. And I was like, oh my God, you did great. And she was like, thank you. She was just like nervous. And ever since that, the third time I got it again, she was working at the floor I was, and she was actually my bone marrow nurse, which I was so grateful for, because I don't think it would have been as amazing as it was if it weren't for her to be there doing it. And she was just keeping me calm, and she used to just
She had you dance before?
Oh yeah, we had done like a little dance in the hallway with the nurses too, with the other nurses, and we were singing and dancing to the songs. And yeah.
How about Megan?
And another nurse that I also really love, Megan, I used to have to swish my mouth with the nasty mouthwash that I didn't like. It was super nasty. It was because I had like bad sores in my mouth. And she used to come in and do it with me. And we used to dance to a song for like 2 minutes, however long it was. And we used to dance and swish it. And then she used to bring me snacks too from the cafeteria. She used to ask me like if I wanted something. And yeah.
Great. Thank you to both of you. And it just shows that although Dr. K's work and discovery was absolutely important to your cure, those nurses just can't be beat, can they?
No,
That's
no.
right. So we will use our remaining time together to allow you the opportunity to ask any questions that you might have of Vanessa and Savannah or of Dr. K. Please use the chat function at the bottom of your screen again if you would like to send them my way. I do actually have a couple of questions that were submitted in advance. The first is for you, Dr. K. And our understanding is that there will be a new pediatric oncology clinic that you're going to be responsible for putting in. Could you tell us where will it be? I think it's going to be at Diamond. Where will it be, and what will it be, and how do you see that it will affect patient care?
It actually is not in the Diamond building. It's for people that know the hospital, it's where the gym used to be. So we took over the gym. I asked for a treadmill in every room, but they didn't grant that for me. I'm teasing because people know that I'm a runner. But it's going to be a state-of-the-art clinic. We really have not had a real clinic for our patients for the duration of the time that I've been here. So it's going to have more rooms. The treatment areas are going to be single rooms. The families are going to have the option if they want to open a sliding door. They could have company with the other patients. So we will have more rooms, space of where the nurses need to be. It's going to be state of the art, and our patients deserve it. We don't only treat kids with leukemia. We, as I mentioned, a lot of different cancers, patients that have no immune systems. So patients would be able to be isolated if they need to be. And I think everybody's going to love it. There's going to be windows. It's going to be a bright clinic. I've seen sort of the models, and some of the families may have seen those as well. And it's under construction right now. Our hope is that it will be finished by the end of February, with hopefully the state approving it and be open in March of 2021.
Great. As a follow-up to that, you were explaining to us that the importance of having specific child space for pediatric patients, that they can't necessarily be part of an adult unit. Could you explain to why?
Kids with cancer are a little bit different than adults, mainly because most of them are leukemias, and we tend to give a lot more intensive therapies. Many of those therapies have to be done in the hospital. So when the patients are discharged, their immune system is weak. They often have to come into the clinic to get transfusions. So we need to be near a hospital where they can get those transfusions. Sometimes they come in very sick, and we've had patients often over the years that were so sick that needed to be transferred to the intensive care unit immediately because of a severe bacterial infection. So we need to be part of the hospital. So we really never had the option to move up, where the outpatient clinics are on the adult side. So this is going to be a clinic within the hospital, and it's going to be the only pediatric clinic that's going to be on site, because we don't have any other clinics that are left in the building at this point, pediatric clinics.
Thank you. Savannah, this one's for you. One of our listeners said, Savannah, you're such an inspiration. Can you tell us the secret to your super positive personality?
I think that you should never give up on yourself because you're you should never give up on yourself because if you want to live and be better again and live your happy life again, then you should fight for your life and never give up.
Those are wonderful words. Thank you. Thank you.
You're welcome.
Vanessa, when you unfortunately had to go through this journey the first time, I trust you started at Diamond in those days. How did you choose Diamond as sort of the provider of Vanessa's care, of Savannah's care?
Yeah, so I felt like we had to be at Banner because that was, even at that time, they were the one that had the most research for children. And I felt like for cancer, like I said, I didn't know anything about leukemia, but I felt like that's where all of, anyone that was very sick would go to because they had the most research, the best doctors. I, really just got very lucky to be, involved with this oncology group, but I knew that that's where I wanted my child to be taken care of is at Banner. And I mean, I would never trade it for anything. So I'm glad that I made that decision.
Thank you.
Yeah,
Go ahead.
because maybe it's not widely known. We are the only place in Southern Arizona that treats cancer, even though kids with other disorders may go to other hospitals for cancer. Everybody comes to Diamond Children's in our clinic. There's no other place that would treat kids with cancer or any blood disorder
In our state.
in our county and in Southern Arizona.
Okay.
So the programs in the state are basically us, which we have now been united. We have one division with Banner Children's at Desert, Thunderbird. So we are one group, and then Phoenix Children's Hospital as well up in Phoenix. But all the Banner docs are part of our division, and we meet on a weekly basis to discuss all patients. And we get a lot of patients that come from Phoenix that have transplants down here.
Thank you. Savannah, I'm going to ask you this question, and if you don't know the answer right away, we'll come back to you. Someone has asked you to describe Dr. K in 3 words. You can use more than that, but.
Amazing, smart, and talented.
Pretty good. I think Dr. K, that's pretty good. We have someone who's asked, Dr. K, how long did it take you to research and come up with your new way of doing bone marrow transplantation?
I showed you some of the results in mice that we published in 2016. That work started in 2012, and the clinical trial opened with our first patient in 2017. So, it's been already 8 years, and we're a little bit past halfway through the phase 1 of the trial. So as you can see, things take a long time.
Oh, yes, they do. Again, a question for Dr. Katsanis. What have you found the difference in treating cancer or other serious blood diseases between treating adults and children? I assume that's one of the reasons you chose pediatrics, but what is the main difference to you?
Well, I'll say the same words that Savannah said. Kids are amazing. They're strong. They're optimistic. They're fighters. So it made the decision very easy. I knew that the focus of my career would have been cancer. I didn't know up front that it was going to be bone marrow transplant. But when I had the choice about choosing whether I will do it in kids or adults, it was real easy. And as even though I do treat some young adults, and we have patients up to the age of 25 on our service, it's always the best age are the young kids.
Okay, thank you. And one last question that we have, again for Dr. K. We're making you earn your living here. What would you sort of say in general are the difference in side effects for traditional bone marrow transplant and the half match transplant? I know Vanessa commented that she felt that, and she observed that the side effects were much less, but what generally, how would you describe that?
Well, I would say for the haploidentical transplants that we've done, patients generally have had less mouth sores. They've had less infections early on, even though as you saw that some patients developed the virus reactivation, not in our clinical trial, but in haploidentical in general. They have had less graft versus host disease, or less severe graft versus host disease. And overall, it's been surprisingly well tolerated. The field in pediatrics has been a little bit slow in realizing how easy these types of transplants have been. And a lot of centers are still doing cord blood transplants, which we have done and have not been as successful. I think the field eventually will have this as their first choice after having a matched sibling donor, which is still considered, obviously here as well, the best, the first choice of transplant. But after that, for pediatrics, since as you saw, parents usually are young and viable candidates to be donors, that's going to replace a lot of other transplants.
Thank you. So this actually concludes our presentation today. Thank you to all of you out there who have joined us, and thank you particularly, of course, to Dr. Katsanis and to Savannah and Vanessa for being here. On behalf of the Banner Health Foundation Board of Directors, I do want to thank all of our donors to Diamond Children's and to our oncology program. It's due to your generosity that we're able to advance science around cancer and provide so many programs and services for young patients and their families. We could absolutely not do it without all of you. I'd like to also thank Chad Rolfs and the Banner Health Foundation staff for sponsoring and organizing today's conversation. Chad will be keeping you informed of the plans to build and open the new Pediatric Hematology Oncology Clinic, as well as any future Diamond Children's webinars. In conclusion, stay safe out there, wear your mask, wash your hands, and stay 6 feet plus. We will be following this webinar up with an email that provides a link to some of the resources mentioned. And we also would appreciate your feedback on this session and any ideas that you all might have for future webinars. Thank you, have a good afternoon, and we hope to see you soon.